Diabetes is classed as a metabolism disorder. According to research, one person dies from diabetes-related causes and 2 develop the disease every 10 seconds. A limb is lost to diabetes every 30 seconds, 7 million people develop diabetes each year, and 4 million die of the disease. Diabetes is the 4th leading cause of global death by disease.
Well, the major crux of the diabetic control all over the world and in Pakistan is to propagate the community public knowledge, is to make the public health institutions aware of this growing risk of diabetes all over, the mortality, the complications, the impact of life expectancy, and the possibility of averting and controlling this problem effectively.
A person with diabetes is a condition in which the quantity of glucose in the blood is too elevated. There are 2 main types of diabetes. Diabetes type 1, in which the patient does not produce any insulin at all. Diabetes type 2, in which the patient does not produce enough insulin or the insulin is not working properly. Diabetes types 1 and 2 are chronic medical conditions that last a lifetime.
Later on in life, patient can have complication in the form of blindness, in the form of kidney disease, renal failure can occur, and patient can have heart disease, patient can have impotence and neuropathy and diabetic foot infections. 8% of diabetes patient diabetic foot problem arise, and out of those 8% people have amputation. Every 30 seconds, some amputation of lower limb is being cut somewhere in the world, every 30 seconds.
Pakistan has a diabetes prevalence rate of around 7% in the 170 million population, which is an alarming situation. If steps are not taken, the figures would multiply to an extent that by 2030, Pakistan would become the 4th leading nation in the world in terms of people having diabetes.
I think we should stress on prevention, because once the disease develops, then it's a lifelong disease. There is no cure for it. You can control the disease, but you can't cure it. 75% of the patients will be from the developing countries, and that will be from the peak of age, 45 to 60 years of age, which is the peak working age. So that is a very, very alarming thing, and then it will give rise to a lot of financial burden on the government and the pocket of the individual.
As far as interventions for diabetes control in Pakistan are concerned, the National Action for Prevention and Control of Non-Communicable Diseases, or NCDs, and health promotion in Pakistan provides a clear roadmap. The plan recommends the integration of the surveillance of diabetes and integration of prevention of diabetes as part of a comprehensive behaviour change communication strategy.
We have to share the information with the public and tell the public that, every family, every community can actually create avenues and opportunities in their life, in their community, to avert the risk of diabetes. And in that context, we start from our children, we start from our schools, we teach a healthier lifestyle, the healthier diet, exercises, playgrounds. And for adults, of course, the half-an-hour walk every day, sprint walk, is very helpful.
Practical measures for translating these recommendations into action have not been forthcoming so far, primarily because of the government's skewed focus on prevention and control of non-communicable diseases. Like previous years, the annual observation of World Diabetes Day in Pakistan will be confined to the holding of a couple of seminars here and there, like the one being held at the Pakistan Institute of Medical Sciences. What Pakistan needs is the sound implementation of the National Action Plan on non-communicable diseases. Adil Sabir, Press TV, Islamabad.